Welcome to the Daily Brief on Milwaukee's health and economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, president of the MMAC, and I'm joined by my co-host, Dr. John Raymond, president of the Medical College of Wisconsin. And we also have a special guest today, Mayor Tom Barrett, who's graciously taken time out of his schedule to join us. Each day at 3:30, we deliver a fact-filled 19-minute update on the health and economic impact of COVID-19, powered by Aurora WDC. So as we begin to close out the week with Friday's briefing, I'll ask Dr. Raymond to update us on the trends and status of COVID-19 here in Wisconsin and the Milwaukee region. And our apologies, but we're having a little webcam challenge, so you're going to hear Dr. Raymond today, not see him.
Thanks, Tim. As you know, I'm here to provide the daily update on our scorecard. And as you know, MMAC will provide you with a scorecard update each weekday, at which time we'll share the number of new cases and the doubling rate of new incident cases in Wisconsin and in Milwaukee. And as most of you know, earlier this week, we showed data that suggested that we were beginning to flatten the curve here in Wisconsin and in Milwaukee. Recall that our daily growth rate of new COVID-19 cases dropped from over 30% last week to below 20% this week. And the doubling rate of COVID-19 cases stretched out from 3 to 4 days. If we could have the next slide, please. Today, we have 105 new positive tests in Milwaukee and 182 in Wisconsin. The daily growth rates were 16.1% in Milwaukee and 15.3% in Wisconsin, showing a slight improvement. Next slide, please. The doubling rate has also slowly improved this week, and we're now at 4.31 days in Milwaukee and 4.52 days in Wisconsin. This is continuing evidence that the social distancing interventions implemented on March 18th by our local municipalities, and thank you, Mayor Barrett, for that, and Governor Evers' Safer at Home order, which was implemented on March 25th, have begun to slow the spread of COVID-19 in our communities. This is great news, but we should note that we still have nearly 200 new cases today in Wisconsin. Next slide, please. The next graph shows more clearly that we are making progress. The straight lines radiating from the 0 point from left to right are doubling rates of 1, 2, 3, and 4 days. You can see that the growth of cumulative cases is bending to the right, which is what we need to see happening. Each curve there represents a data set. Green for the state, light blue for the M7 region, dark blue for Milwaukee County, and teal for Waukesha, Washington, and Ozaukee counties combined. So this is great progress. The next graph shows the cumulative cases in Wisconsin, M7, and Milwaukee County since early March, shown on the vertical axis. Time is shown on the horizontal axis. And I please ask you to note that the vertical axis is presented in a logarithmic scale, which compresses the apparent growth. The main point is that the number of cases is still growing, now at nearly 200 per day in Wisconsin. If I could see the next slide. The final slide shows that our cases are growing at an exponential rate with some day-to-day variability in reporting. And I believe that this exponential growth rate has been attenuated by the interventions that Mayor Barrett, Governor Evers, and the business community have implemented to try to help flatten the curve. But we still have a lot of work to do. So what does this mean for us? First and foremost, if the trend continues, it does mean that social distancing is working here in Wisconsin, but it does mean we can't relax. If anything, we've got to redouble our efforts to slow the spread. The number of cases are still rising here in Milwaukee and in Wisconsin, and we expect them to continue to rise for weeks or longer. We still need to work hard to push the doubling times out past a week and maybe out to 2 weeks. And we need to do that quickly before the capacity of our health systems to provide ICU care and ventilators will be exceeded. And it does look like we're going to be reaching a point within the next week to 10 days at which we'll be at capacity for our health systems to be able to provide ICU care and ventilator care. So I'd just like you to think about COVID-19 like a runaway train that we're watching in slow motion in a movie. The train is going too fast to stop before it crashes into the station. We're pulling the brakes to slow it down, but it's going to crash into the station no matter what we do. We see that now all we can do is work harder to minimize the damage. We've seen this movie before. All we need to do is look at New York City and New Orleans to see what's in store for us. We can see that the train is going to begin entering the station this weekend, and we're watching in slow motion, and we know that the train will crash into the station in the next week or so, and the train cars will slide off the rails and continue to damage the station for weeks to come. So we still need to stay on top of this problem. So thank you, Tim, for the opportunity to do the update, and I'll turn it over to you.
Thank you, Dr. Raymond. Always good to hear you. And this is a chilling analogy because unlike most train stations, we live in this train station, so we can't move. So we have to prepare for that train. Tell me again, kind of your sense of this is the first full week of data and where we've seen that doubling time slowly inch up. And ideally, again, where would you like to see the doubling time get to before we know we're moving in the right direction?
Great question. The simple answer is it would have been nice if we were here a few weeks ago because we wouldn't have had the same urgency to get the doubling time compressed. We need to get it out to a week and then out to 2 weeks, I'd say within the next 10 days.
And then you also mentioned you feel like we are, if the data holds up, within a week or so of seeing the peak number of cases here.
I think that's fair to say, and obviously all of us are following the models that are publicly available on the internet, and the health systems here are working very closely with each other to monitor capacity. I think the estimate that 7 to 10 days from now, we're going to be facing some challenges with our bandwidth and capacity for the ICUs and the ventilators that we have is real. What I also want to say is that the health systems working together have been able to increase their internal surge capacity by about 40%, which is quite remarkable. And I think it's a hallmark of well-functioning health systems that have really pulled together to try to do everything that we can to address this crisis.
Good. And then one final question before I turn to the mayor. When we sit down to do this next Friday, optimistically, where would you like to see the doubling rate?
I'd love to see it bent down to about 7 days. That's probably not going to be feasible, but let's do everything we can, especially to try to intervene and give good information and good support to the 2 hot zones in our community, which are in the near northwest side and the near south side. And obviously anybody that follows the Milwaukee Health Department website knows that those hot zones now have spread out over the entire region.
Thank you, Dr. Raymond, and I know you'll stick around for questions. Mayor, thank you very much for taking the time to meet with us here virtually. And thank you again for your early leadership in putting the city in a position that it's in today. So the first question I have for you, Mayor, is I know you were on quarantine a little bit. How are you feeling and how are you doing with a full house?
I'm feeling very good, Tim. Thank you for asking. And this is a time where I think all of us should be staying as close to home as possible. So even though my formal quarantine time is over, I've been getting out for walks in the evening, but by and large, I'm staying home, and that's what I urge every single person to do. Please stay home.
So I know you're missing very much the door-to-door nature of a campaign at this stage.
Absolutely. I actually am missing it, to tell you the truth.
So big news yesterday, Mayor. Can you tell us a little bit about the decision of the DNC and what you think that means for Milwaukee?
Well, I thought the decision was first and foremost absolutely the correct decision and the best case scenario for us here in Milwaukee and Wisconsin. All of us recognize that the chances of having a convention in mid-July were growing slim every single day. one of the things that probably in a strange way benefited this decision was a decision by the Olympics to postpone until 2021. Because when these dates, the original July dates were chosen, it was to work around the Olympics. Well, once the Olympics decided that they were going to move to 2021, that opened up a big time period during the month of August. And that's when the decision was made. I got the phone call from Tom Perez, the chairman of the party, who said, we're going to use that week of August 17th, which is the week right before the Republican convention. And I know right now a lot of people aren't thinking about the convention, and they shouldn't be thinking about the convention, and we're not spending a lot of time working on the convention. It's very much on the back burner for the city. But I'm very optimistic always, and I'm hoping that if we have this during that third week of August, that will be a much needed shot in the arm for our local businesses, our hotels and restaurants, and hopefully will be the springboard to get us back and get businesses back in full circulation. I think that's what every one of us wants, and I'm hoping that's what we're able to accomplish in that week of August 17th.
Mayor, we've heard discussion across the city about a couple hotspots where this is hitting residents much more directly than in other parts of the city. Can you tell us a little bit about that and kind of what your responses are?
Sure, and I want to thank Dr. Raymond, he was probably one of the most powerful voices at our first meeting about the seriousness and the importance for social distancing. It was very impressive to see what he brought to the table, what they're already doing at the medical college. But when we started seeing the data, and Milwaukee County has done a great job, Dr. Ben Weston has done a great job in compiling the data, I could see very early on that we had a hotspot basically in the Sherman Park area, and that hotspot continues to grow. It's now grown to the northwest and to the northeast, and we're seeing a large percentage of the cases for the city in those areas. The city of Milwaukee comprises about 78% of the county's cases right now. Now the cases are spread out through all of Milwaukee County, but we still see a disproportionate impact. And I think the epidemiologists are going to be looking at this because it appears that there are obviously other factors that are at play here. And I don't know if it's asthma, I don't know if it's diabetes, I don't know what it is. And I'll let Dr. Raymond and the other healthcare experts try to surmise why we have seen this. And I don't know if it could have been some social event or something that really triggered things. We've seen that around the country, but we know that it has hit the Central City hard. We know it's hit the African-American community very hard. And a large proportion of the people who have died have been African-Americans and African-American men. So it's really had a big impact there, and it's something we're very concerned of. But now we're seeing a spot on the south side. We're starting to see more cases in West Dallas. So I don't think anybody should feel cocky and think, well, we don't have it. I think that's part of what got us where we were in the first place. I think initially, most of us as Americans thought, well, this is a Chinese issue, and then this is an Italian issue, and then this is a Seattle issue, and it's a New York issue. Well, now it's an American issue.
Mayor, what's on the top of your list for things that the city of Milwaukee needs to address this? And how well is the coordination going between the city and the state and the city and the county? Because obviously the disease is pretty porous, so we need a unified response.
Well, I think that the testing remains an issue, but I have been very impressed. And again, Dr. Raymond has been part of this as well. I've been very concerned about our surge capacity and the ability for us to have hospital beds. Like many of you, I've seen the pictures from Italy and from Seattle and other places where they simply don't have the hospital beds. And so we've been fortunate that we've had the hospital systems come together, enter their data, work together in a way that I'm guessing they haven't worked together before. And we're putting together a pretty good projection over the number of beds we need, over the number of ICU beds we need, over the number of ventilators we need. And some of it comes from the analysis done in the state of Washington, but it's more important that we do the analysis here because I think we can have better, more real-time data. And that's happening. That's happening right now. That's what led us to petition the state to ask the Army Corps of Engineers to designate the convention center at State Fair Park as an alternative health facility. So we can add literally hundreds of beds there in the event that we need them. My hope, and I think everybody's hope, is that we're not going to need them. talking to the Army Corps of Engineers, they wanted us to get that request in as quickly as possible. They've already done some work in Chicago. They've done some work in Detroit. And so we've worked very closely with the county. We've worked well with the state. Again, the hospitals have been tremendous to work with. And that has been really encouraging to me to see everybody coming together because they recognize how important it is.
Great, thank you. Chris, I'll go to audience questions if we've got them.
Yeah, our first question is for Dr. Raymond. Dr. Raymond, we had another question about people who are not on the front lines, just average everyday citizens, potentially wearing masks out in public, and what the benefits of that are again, and whether there's a downside of a potential false sense of security, but if you're wearing a mask around.
Okay, great question. It's very complicated. Let me just start by saying for surgical grade masks, N95 masks, and face shields, we really need those to be for the frontline healthcare providers because they're the people that are at the most risk and the people that we need the most to be able to deal with the surge that we're going to have. I'd prefer that we start talking about face coverings and not masks for people in public, a bandana, a scarf, a cloth mask. I think those are smart things to do, and I have a feeling that many healthcare leaders are going to be recommending that over the next few days. What are the advantages? The advantages, really, in my view, are twofold. One is that it gives you a sense of participation, that you're serious about social distancing, and it sends a message to everybody around you. The second advantage is that if you are asymptomatic and could be spreading the disease, that you've got something that's protecting the people around you. I think those are the two most important things. We don't want people to be complacent, and if you're going to wear face coverings, you need to be very careful about your hand hygiene and not touching your face.
Yeah, and then Dr. Raymond, we had another question about just the definition of doubling rate. Is it a literal doubling of cases in 4 days or 4.3 days?
That's exactly what it is. So if you think about it, doubling 2 weeks ago was going from 1 to 2 cases. Doubling now would be going from 2,000 to 4,000 cases in Wisconsin.
Mayor Barrett, we had a question about whether there are guidelines or best practices for apartment complexes in the city of Milwaukee where, people are in close proximity and they may be using common facilities.
What we ask is that people work with our health department. We're doing this in our Department of Neighborhood Services in real time to try to give that guidance. And I think the challenge all of us face is that this is so new for all of us, but the basics are still very, very much the same. The social distancing is incredibly important. And when we see the encouraging data that we saw from Dr. Raymond about the leveling, although it's not as much as leveling as we want to see, I think that those decisions that individuals make about social distancing go the farthest in helping us address this as a community. So I would say first and foremost by far is, even in those close quarters, to employ the social distancing. I think one of the biggest fallacies here, and unfortunately we're seeing the tragic results of this. There was a story about a choir in the state of Washington. It was about an hour north of Seattle, and this was back March 10th or so. And they came for a choir practice and they disinfected their hands. They didn't hug, they didn't kiss, anything like that. And there were 60 people there, 45 tested positive, 3 ended up in the hospital, 2 died. Or the funerals in Georgia. And I just got a text from a church that wants to do an Easter service. And I think the message we have to get across is that whether it's church services or choir practices or even elections, it's not like there's a grace period where it doesn't apply. This is going after everybody, no matter where they are, and that includes apartments.
And Chris, I think that's a great recommendation to end on as we close out the week. And again, thank you, Mayor Barrett. I know you're very busy, for your gracious time with us and for that closing message about the impact if we don't take this seriously. Dr. Raymond, we'll see you again next week, and thank you for, again, your leadership and the factual updates that'll keep us focused on the right numbers and the right goal. So have a great, safe, and productive weekend, and we'll see you next week.
Thanks, everyone.
Thank you.